This month, experts in our area have been working to make our community smarter when it comes to brain tumors. It's a topic where the more you know, the better off you'll be. And that's why we're talking with Dr. Maya Ratchova. She's a neuro-oncologist with the Givens Brain Tumor Center. Thanks for being here.
Thank you.
You know, of course, of course, you can get more people in the know about tumors. That can really be life-saving. So we can know that tumors can be cancerous or non-cancerous. How do those differ in the way that they impact our bodies?
So we typically think about tumors as a collection of abnormal cells. However, cancers are tumors or cells that are aggressive and rapidly dividing, that invade healthy tissue. And that's why tumors could be benign or malignant cancerous. And we also define tumors as primary, originating in the brain, or secondary, that metastasize to the brain. And definitely tumors, regardless of whether they are benign or malignant, can affect ours because it depends on anatomical location.
Yeah, absolutely. It could definitely be a pretty scary topic that, you know, could lead to self-diagnosing or anxiety. What are some signs that we should be looking for that something's wrong?
So definitely don't dismiss any neurological symptoms you have in your loved ones. Important to know that a lot of the signs can be focal, like in patients with stroke, like new onset weakness, sensory deficit, language, personality change, but a lot of it can be also very non-specific, such as headache, feeling tired, not feeling yourself.
Yeah, absolutely. Don't ignore those signs for sure. So early detection, of course, would be very helpful in addressing anything. What's kind of the timeline for tumors and early detection?
It depends on the tumor type. We have different grades of tumors and different tumors, but early we detect tumor of any kind, the better, because the size matters, because our surgeons and our radiation oncology colleague are able to do more precise surgical resection and actually do radiation treatment that does not impact healthy brain. So early is the better, less symptoms patients will have if we need to do surgery or additional treatments.
Yes, that's so important. And what's important too, I know you guys have been doing a lot of research about tumors. Can you let us know what developments you guys have found that are giving patients some hope?
Importantly, we're very lucky. In recent years, there's been lots of developments. Of course, imaging, advanced in imaging, in diagnostics, advances in radiation oncology. Now we have protons, photons, and also in chemotherapy realm. We are now treating patients with immunotherapy, and our new advances, CAR-T therapy, and actually targeted therapy for brain tumors.
Yeah, and how many patients have you seen coming in for these new advancements?
Well, we definitely have clinical trials open, and a lot of big institutions in the state and in the country have a lot of clinical trials. And we offer clinical trial to everyone who's qualified, because on the National Cancer Guidelines, offer clinical trial is the best treatment option for the patient.
All right. Thank you so much for your highlighting this topic and teaching us more about what you know. Of course, like the doctor said, if you have any signs that something's wrong, please go get checked out. There are